All right, let's go ahead and get started. And this presentation will be recorded for those that had conflicts or want to review it later. My name is Bruce Eddy. I'm Executive Director of the Community Mental Health Fund, and I want to welcome everybody to this pre-proposal presentation. This is for 2023 applications for our safety net and children and families funding programs. And if we can go to the next slide.
For some reason, when I do presentation mode, I can't see anything except for the so I'll keep it like
Okay,
this.
we'll work with it. So what I'd like to do is just take a chance to have us introduce ourselves, and for the efficiency of time, we'll try to go in the order here that's on the screen, and I will also ask. So we'll start with staff. I'm Bruce. I already introduced myself. Taryn.
I'm Taryn Lichty, Office Administrator / Data Analyst at the Mental Health Fund.
Rochelle.
Rochelle DePriest, Program Liaison with the Community Mental Health Fund.
Susan.
Susan Jones, Senior Program Liaison with the Mental Health Fund. Welcome, everyone.
Okay, and now the reason that we're here, our wonderful providers. Comprehensive Burl.
This is Carl Anderson. I'm the Communications Liaison for Comprehensive.
Hi, Carl.
Hey.
Family Conservancy. Anybody? Okay, we'll move on. JFS.
Hi, Hayden Rand, Program Data Manager here at JFS KC.
Welcome. Casey Care Health Center. Maddie Rhodes Center.
Hi, this is Julie Youngers, Grants Coordinator at Maddie Rhodes.
Good morning, Julie. Rediscover.
This is Amy Kerrigan, Contract Manager at Rediscover.
Hi, Amy. Thanks for joining us. Samuel Rogers Health Center.
Manuel Solano, Director of Behavioral Health. Nice to be here.
Hi, Manuel. Swope Health.
Hi, this is Karen Settis from Swope.
Good morning, Karen. University Health.
I'll go. We have a bunch of people on, but Robbie Phillips with University Health. It's good to be here.
Jenna Harper. I'm the Senior Director for Quality at where am I? Truman University Health. Good to be here. Thanks, Bruce.
Eric Knudsen, Director of Quality Improvement at University Health.
Amber Takens, Project Coordinator, University Health.
Nona Perry, Patient Accounts Manager, University Health.
Stacey True, good morning to people with VA's Finance Associate Professor.
Ron Rohde, Director of Finance.
Wow, you are well represented. Glad to have each of you here. Now for Children and Families, Kappa.
Hi, I'm Megan Campbell, VP of Development and Communications.
Good morning. Children's Place. How about Cornerstones?
Sally Hornstra, Grants Manager at Cornerstones of Care.
Hi, Sally. Thanks for joining us. Crittenton?
Carol Ann Merced, Public Funding Specialist.
Good morning. Foster Adopt Connect. Niles? Okay. Hi,
I
I got,
hear that microphone is not working.
I saw it in the chat. Thanks for joining us. Where does that take us? Operation Breakthrough.
Jane Webb, I'm the adult and family therapist.
Ashley Bland, Director of Clinical Services.
Good morning to both of you. Sheffield Place.
Good morning, David Hanslick, Director of Program and Development.
David, good to see you. And last but not least, Stepping Stone.
Ashley Hunley, Grants Manager.
Good morning, Lynn Durbin. Stepping
Good
Stone.
morning. Good to see you. Is there anyone else that we've forgotten? Anybody else on the call care to introduce themselves before we move on?
Hi, I'm sorry. I'm Jessica Kibbe with Operation Breakthrough, Director of Social Services. I didn't quick mute fast enough, so sorry.
No worries. Thanks for being on.
And I'm Melanie Hayden. I'm the Director of Foundation Relations at JFS KC. Sorry, I was a little bit late.
No
Hi.
worries. Good to have you.
I'm Samantha Sedith. I am the System Director of Grants for Borough Comprehensive.
Good morning, Samantha. Okay, I think we're ready to talk about the scope of our discussion. And as usual, we're not going to talk about everything. What we do want to do is focus on the updates and try to assist you by clarifying some of the pieces of the application that are worthy of note, because there are either new questions that have been added or things that have been substantially reworded, and there may be some past questions that required us to get back with you and ask you to provide more information. So in the interest of your efficiency and ours, we want to just let you know those spots. And because of that, this is not a substitute for the full application. We're not going to talk about all the questions, just hitting the high spots. And I think we're ready for the next slide. So a few important points. This request for proposals is for our current grantees. And as always, all the stuff that you need is accessed by our billing portal, which you can reach from any page on our website. Most of you have usernames and passwords that were established in prior years, and those are still active. If you need to add a new user, we try and make that as easy as possible. Just contact Susan here and she'll get you taken care of. Then a few more details. As you know, we have a document called the service unit definitions, and there have been some updates to that. And so those are the services that we're going to be using for the 2023 proposals. And those are on our website, same place, the existing grantee funding page. And if you go right there, that'll get you taken care of on the service units. I'm going to come back to the acronyms. We always ask this. It really helps us. You know, we work with organizations across the lifespan in a bunch of different areas. And so things that are familiar to you in terms of instrumentation and so forth may not be to us. So we'll talk about that in a second. A lot of the spaces for responses are pretty limited. And so we're really wanting concise answers, and bullets are fine. So if you have opportunities to use bullet format, we get that and we appreciate it. It really helps us in our job. Sometimes you'll see questions that ask for data, and that's a good indication that we're looking for quantitative information. So just a little hint. Now let's talk for a second about acronyms on the next slide, please. And so particularly for newer folks, here's the convention that we use. just assume that we're not familiar. We probably are, but not everybody all the time. And so the first time you use an acronym, spell it out, and then put the acronym that you'll be using henceforth in parentheses. And then after that, we'll know. So that's the easiest way for us to communicate around that. There have actually been times where we couldn't figure out what was going on. And so we had to ask people to make another pass at their application. And I know you don't want to do that, and we don't want to do that again. So here's the way to prevent that. So then on the next slide, as usual, there are 3 sections in the application. There's the grant application information section, and there's a drop down in there, and you'll want to select core services. And the reason for that is that there are some organizations that have more than one contract. So this just helps keep us straight. And then I think the rest of it's pretty self-explanatory.
Bruce, if I could really quick on the grant name. So you're gonna, from the drop down on the portal, you're gonna select the category of funding that you are applying for, obviously safety net or children and family. The grant name for all of you is core services. And that is specific because, as Bruce said, yes, we have had organizations that have had multiple grants in different categories, but for all of you folks that are on here now and that we're currently funding, that name is core services. And that as a grant name connects all of your data and information in our portal. So
thanks, Susan. Just keeps us all straight. And then I think we're ready to talk about the next slide. And Rochelle is going to take it from here.
All right, good morning, everyone. So the next section we're going to talk about is the agency information. That's where you're going to put all your primary contact, the agency information, your employer identification number, all those different things. We have service address, so please remember that we only want the service addresses that go with the services that we fund. If you put something on there for outside of Jackson County, it raises a whole bunch of questions with the people who review. So just make sure you put service addresses of the ones in which Jackson County Community Mental Health Service supports. Next slide. So of course, with agency information, this is a section where we're going to have all types of forms and documentation and backgrounds information on your board. And so again, we're asking this year for agency board approved cultural competency plan. Remember that right now on the application, these things repopulate. So if something is new, you have to go in, delete it, and then upload a new document. So please remember that. Next slide. And so these are some of the agency documents, or these are the agency documents that you do have to provide. If you see the list here. But we do want to talk about the agency revenue and expense pie charts. Next slide. So when we're doing these, we want pie charts only. And one of the big things is making sure that you give the dollar amounts for each thing you put in there, but also the total for revenue and the total for expense, because we use that information in other areas. And it's not fun to have to go and calculate all that yourself. So if you can make sure, like it says, 2020 revenues, 3,381,689 is the total. Remember, if you do have some small grants, you can kind of add those together and kind of say other. You don't have to put, if you got 15 and the pie chart looks like a striped shirt, you don't have to do that. Next slide. So now we're moving to the application information, and I believe I'm sending that over to Susan.
Yes, you are. Thank you, Rochelle. So application information section is the nuts and bolts of your actual proposal, the information related to and specific to the services that you are proposing. Next slide. So we're going to run through most of the application form questions. This is your narrative section. We may not capture all of them. There's been very limited change since last year. So question 1A, we are asking for you to explain the overarching practice model or approach for services in your organization. So what is the umbrella that guides practice and service delivery overall? We know that evidence-based practices are used, and that is a good thing. And that your service model or philosophy may very well dictate particular practices, and it's fine to include that, but we just want to make sure that there's an understanding of the distinction of philosophy of practice as separate from evidence-based practice. So philosophy versus actual service delivery. We always say on here, if you don't have something or don't have the answer, just indicate that, but we know that you all do have an overarching philosophy. So you can speak to that here, and just, you can be very brief. Next slide. So we are asking to list the main outcomes for your proposed programs and services and how they're measured. And this is a character limited section. There are 5 spaces to list a program measure. It doesn't mean you have to fill up all 5. And some of you may have more than that. But what we're asking is that you prioritize the measures that you are talking about with those services that have the majority of mental health funding. You can also combine things, let's say therapy, individual therapy and group therapy. You may be using the same type of symptom checklist. You can group those together. In that instance, however, you may have a different baseline for group therapy and individual therapy, or for adults and children. And if so, you can, in the same section, you can just indicate what those different baselines are. Next slide. So just to get into the detail of what we are looking for here, for each of the measures that you indicate, you want to identify the instrument that's being used. This is a good place where we see acronyms, so just remember spelling those out. We're going to ask for the baseline, and that is typically an average measure of the level of functioning score, condition, however that is captured within your instrument for the target population or the service or I'm sorry, at the start of service or intervention. So that would typically be data that you gathered on that measure for your population. Could be the previous quarter, could be the previous year, whatever time frame that you are looking at that says, this is how folks did on this particular measure most recently when we measured that. Validated, we want to know if the instrument is or is not validated. And that's just means it's an instrument that has been researched and statistically it's been determined to measure and perform as it was designed to do. So if you're doing a scale in-house that you have created, that's fine, that's perfectly acceptable, but it probably is not a statistically valid measure. Meaningful improvement, this is where we're looking for the targeted or expected change, and typically that is going to be a change in score, a reduction in specific symptoms, etc. So much more detailed there. And then the functional outcome is speaking to what does that mean? So if you're targeting that the score for depression is going to be reduced by 5 points, the functional outcome is that you are actually reducing your depressive symptoms, or another measure might be looking at quality of life. Functional outcome being quality of life is improved. And at the top of this slide, you see there's some blue buttons. These explanations or definitions here are available to you in the portal. If you click on those, you can see them. Next slide. And so here's an example. The service or the program is individual and group therapy. There's a validated instrument, the XYZ Anxiety Index. And in 2020, the last time data was formally collected and analyzed, 73% of participants met their target for improvement. What was that target? That those scoring in a moderate to severe range at the start of service decrease that score by 3 or more points. The functional outcome, symptoms of anxiety decreased and overall daily functioning increased. Next slide. Question number 3, 2 examples of how outcome data has changed or improved program services. So we're looking for out of your quality processes in looking at those baselines and the change that we talked about in the examples. Receiving that data, getting that data, what is it telling you, and how are you changing program or interventions as a result of that being informed by that data? If you don't do that formally, just say no. But an example might be that we collect data on participants' improvement in depression, measured by the Beck Depression Inventory. After 3 months, we saw youth scores showing little change, while adults improved significantly out of the clinical range. In response, weekly number of sessions increased for youth and added a medication review to that population. And on more recent gathering and reviewing of data, both groups are now in a similar improvement range. Next slide. Question 4 is a fillable table. We're looking for diagnoses of your participant population if you collect that information. Not good or bad if you do not. In some situations, organizations simply don't diagnose, and that's okay. Also, so there's a total on that table. And since you're listing diagnoses, if an individual has more than one diagnosis, then the total number of diagnoses that you're representing in that data is going to be higher than the number of folks that you serve, and that is expected. Question number 5, this is an important one. We're looking for you to talk about major changes in conditions in Jackson County that are affecting your operations, those you serve. So it might be related to staffing, participant demographics, or acuity of those folks. We're still interested in how the ongoing challenge and reality of COVID is impacting your organization. Medicaid expansion, what we're looking for there is less less related to how it's affecting your actual participants served, but how it's affecting the organization in terms of numbers served, your capacity overall, and significantly, especially with this, your group of agencies for these two grant categories, Medicaid expansion, and certainly the also the impact of the CCBHC model is having a financial impact on how the extent to which and how mental health funds are utilized. So that's really important to educate us as staff and the board on those realities that you're dealing with. Question number 6. Same question with a tweak. We want you to list 5 major sources of funding for mental health services. So we're focusing on, last year it just said funding for services, but we really want to hone in on other support that you're receiving specifically for mental health treatment and services. Next slide. And I think we are moving to Rochelle.
Yeah. Okay, so we have slide number 7. I'm sorry, question number 7. And it just talks about some of the basic social determinant needs that your participants will need. And so we really go, we have our focus on Healthy People 2030. And so you'll see kind of the different areas in which we're focused on. And so you'll be putting information in there to say, how are you helping people with economic stability, or how are you helping people with healthcare access and quality? Everyone's been doing a really good job at completing this on the applications in the last few years that we've had this. So this is great. So just keep doing what you've been doing. Next slide. Question number 8. We just want to highlight that we want new community mental health fund participants enrolled in the last year. So not total that you've served, but who all are new. Some questions and some concerns came up during our forums that we had with value-based, where we were seeing that the number of people who were funded by the community mental health fund, it went down. So we want to make sure we keep an eye on that number. So that's why new is highlighted. Number 9, we want to look at how you assist participants to enroll in MoHealthNet. And so even though we know some of you guys don't have a funding stream for MoHealthNet, we just want to see if you are helping people with their checking their eligibility, or helping them with their applications to enroll. This can be as simple as you do referrals out to places that do help, or that you do it in-house. Also remember that if you don't do it within your mental health department, but it's done outside in another department within your organization, that is fine also to put down. Questions 10 through 12 had no changes, and that was around language access and school-based services. Next slide. So one of the most, and this is the most important question. This is one of the questions that we get a lot of response back from the people who review these applications, and that is to explain the reasons for major changes in your expenditure plan. And so as you look at some of the things that are happening with COVID, a lot of group and cycle ed went down or to 0. And so you might have increased individual therapy and family therapy. We like for you to explain that in question 13, because that helps our reviewers know that, okay, this is different from last year. Why are those people still getting services? Also, if you are requesting a new service, you really need to explain why you're requesting that new service. Is it something that, as you see going out of COVID, people are more interested in and you're able to provide that service? So please make sure that you give explanation for any increases or major allocation changes. Next slide. And so here are the additional documents that are within this. There's a template provided for a personal summary, line item budget, and cover page. Please use that template that it's provided, and then staff licensure. You just upload that, however, in a PDF form. If someone is working on this outside of the application portal, you can go to our website and those templates are there under required documents. So if you have someone working outside of the application on those, they can do that outside, but the template is provided and we ask for you to use that template. Next slide. And I believe this is handed back over to Susan.
Thank you, Rochelle. So the expenditure plan, there's no changes in what this document is or what it entails. You'll be picking from a drop down of services that you see there on the upper left, and all of the services that you can select from are those that are in the service unit definition document that Bruce referenced earlier. So you're going to select your service, indicate whether it's fully funded or partially funded. For a fully funded unit, this is where in that service unit definition document, the prices for most all of the services that folks are eligible to propose, there is a set cost for that. So you're just entering in the number of units, it's doing the calculation for you, and then you're indicating whether or not that service is for adults or children. Below that, residential treatment was selected as a service. Residential treatment is an example of one service that doesn't have a set unit cost because that is very, very variable within organizations. So on that, if there isn't a noted prescribed cost, you're going to select partially funded. You're going to indicate the number of units you anticipate to deliver. And then in the red box there, that's where you're going to enter in the total cost of what those 10 units would be at your rate. Partially funded also applies to situations where, for example, there might be a sliding scale for individuals for services, or the mental health levy is picking up part of a deductible or a copay for someone that may be insured. And so the levy is only paying for a portion of that cost, and that applies in this situation as well. Next slide. Oh, okay. So I wanted to make sure that we pointed out, so this is on your homepage of your application. And as you fill in the expenditure plan, there's going to be a total cost that is calculated. And in this case, what I had entered equaled $3,850. And on the front page, I entered that we're actually proposing $10,550. So just be aware of that. And it may mean that you know, if you're off just a little bit because the services that you're proposing aren't adding up to a perfectly nicely round number, you can just adjust the amount requested to equal that of your expenditure plan on this page. Next page, third slide. Staff demographics we're including again, and we will continue to have this. This, I believe, is the second, if not third year of collecting this data. We will be trending that, looking at it over time. focusing in on how the diversity of staff in organizations is looking, and focus specifically in terms of full-time, part-time positions, as well as type of positions, executive leadership, middle management, direct service, etc. So for the data that you're entering for staff, the portal totals it for the bottom for you, and your grand total at the left is going to be larger than the number of folks that you have employed, most likely because you have part-time and full-time positions reflecting. On the board of directors, double check the total members in that upper left-hand corner because it does not automatically calculate for you. Next slide. All right, back to you, Bruce, to head this one off.
Thank you. So this is actually my favorite part. And so we have a number of themes in the questions that we get. And so to save time and hopefully provide the broadest possible information, I want to share some of these. So one question that we get often is whether multiple people can work on the application with their own sign-in credentials. And yes, they can. The way that it's set up is we admit kind of a limitation in terms of messaging. So there is a contact that's identified by the agency, and that's the recipient of status updates. So choose your contact carefully. Another question that we often get is whether there's confirmation once the proposal is submitted. And yes, we do provide that. And thanks a lot to Taryn for providing that. And then the portal itself does also provide status messages. Is it possible to have more than one agency contact? No, currently we can't do that. So again, it's important to have somebody that's able to receive, monitor, and respond to those messages when they come in. Another frequent question is whether there is a downloadable application template. And unfortunately, we don't have that yet. It would be nice to do that. It's a production challenge, but we have at this point added a print feature, which we hope should be helpful to you. There's a send message box, and it's not always apparent what that's for. But once you submit the application, that is the process by which we request clarification. We might ask for some follow-up information or get into specifics about proposal revisions. So again, those are the messages that go to the agency contact. And on the next slide, are all services on the service unit definitions available to be billed? And so we can give kind of a definitive maybe on that. It really depends on agency capacity. So for example, there's psychiatry that you'll see on that. And so obviously not all organizations are going to have the personnel and the licensure to be able to bill those things. If you're proposing any new service, then here again, this is a great opportunity to explain that fully in question 13. And Rochelle said this is probably the most important question, and that's the one that people go to understand changes in the overall profile of what you proposed. There are some services on the service unit definitions that say this requires prior approval. And so don't hesitate to contact us if you have any questions about that. Probably the most common question is whether or not the Board of Trustees is considering increases. And due to COVID, there were a lot of issues that everybody knows well. And the board allowed some carryover temporarily But we're kind of getting back to normal now in terms of how we manage funding and try to keep our own finances straight. So we're going back to the idea of material underspending, and agencies that fall into that category have already been contacted. So basically, if you request an increase, no matter what your situation is, we really want to look at not just the need for that, but the ability to document that you've got the capacity and the utilization strategies to meet that need. And again, if you want to discuss that further, you'd be most welcome to contact us. We certainly want to assist everybody that's got the capacity to expand. So don't hesitate to call me on that one. Sometimes people ask us about shifting services from one area to another, and is that okay? And again, that's something that would be good to explain in question 13. Typically, when there are big shifts, there will be a question about how the needs will be met from the services that are being decreased. So just kind of anticipate that as something to explain ahead of time, and it'll save us both a lot of time. But just to sort of explain the thinking, if you shift away from something, folks on our end will want to know how that need is being addressed. And then on the next slide, certificate of good standing. So that's just the thing from the state that says that any entity can legally do business in the state of Missouri. We don't need a certified copy, and you ought to be able to go to the state auditor's website and obtain that pretty easily. Word limits come up pretty frequently, and there aren't any unless there's a limit stated, but we always want to have very concise responses, just kind of as a rule of thumb. Occasionally, we get questions about allocation to personnel, fringe, other indirect costs within the line item budget. And yes, there are limits. So personnel costs, which we define as salary and fringe, should be at least 70%. And we typically go do the math ourselves and look at that. So that hasn't changed, and folks that are old hands at this understand that. But that's something that's been a long-standing practice for us. Sometimes we get questions about outcomes. There are several blanks to list services, but we've got more than that. And so sometimes it's sufficient to talk about programs, which encompass many services. Not all services are going to be necessarily listed there. The expenditure plan is really the place where you want to explain all of those. And that's an important question. I'll just, on this one, see if Rochelle or Susan have anything to add before we move on. It's a pretty important question. Anything else to say on this?
I think you covered that.
Okay.
I would, however, if I could go back to the word limits. We think that we have corrected this or had it corrected. Please be sure to really review your application. There's a print feature. And so if you look at that and you're able to view the application, in some places in the past where there has been a word or character limitation, you've been allowed to continue typing and then past that limitation, and then it just cuts off in the proposal. So just be cognizant of that. We hope that it has been fixed. If it has not, please bring it to our attention so we can address it, but just be careful so that we are sure to capture everything that you are wanting us to see.
Thanks. I think we're ready to move to the next slide where we have a few more things for you.
Oh,
How do we
that's,
complete? You want to do that?
you want me to go ahead?
Please.
I addressed the expenditure plan when we talked about that. If the service unit definition does not indicate a cost, then you will enter it as a partially funded unit cost. And if you have, that would be okay to contact us if you have a question specifically about that piece. Make sure that you double check the costs on the service unit definitions that were updated in 2022 to see if there are any changes. But if it's a fully funded service, the portal is going to populate the unit cost at any rate. Sometimes folks have asked that they were proposing a particular service. It's no longer in the service unit definitions. A couple years ago when we revised that, some definitions were consolidated or taken out. And so you would have been contacted to understand the service that you were provided and what definition it falls under. But that isn't new. I think most everyone, we took care of that in the last funding round last year. Also, there's a question when young adults is a part of the service delivery, what age range is specified. That isn't prescribed by us per se. But if you need a particular guideline, you may want to consider legal guidelines for what an adult is considered, but just use the population and the age range that you are defining within your organization for that population. Next slide. So just some overall suggestions, keep it simple. Many of you in this group have been receiving mental health levy dollars since its inception back in the 1980s. So keep it simple. We know, especially Rochelle and I, we know a lot about your organizations and your programs. So highlighting the most critical things that you want us to know about using bullets is perfectly acceptable. If we don't understand, if it's too brief and we're not sure, we will certainly ask a question. So don't be concerned about that. Do your research. Rochelle spoke to social determinants of health. We have had situations where not very much is listed, or things that we aren't expecting is listed for a particular organization. And so just do your research in terms of what exactly is a social determinant of health if that language isn't familiar to you, because many times we know full good and well that social determinants of health are being significantly addressed within your organization, but the response on the application doesn't match that. And that's a good example of the next suggestion, is just assuring that there is internal communication from the program level all through your organization, not simply to leave it on the shoulders of your development folks or your grant writer, because there are some specific things that need to be represented from the program level, and you want to make sure that it's all accurately reflecting what you're actually doing. That was no disrespect whatsoever to development folks and grant managers, because that is a we understand the seriousness of that position, and we also know that you folks are wearing many hats and writing many grants. So lean on your team members to make sure it's accurately reflected. Okay, next slide. Questions. We want to open it up for some questions. Broad questions specific to the what the application is asking for, not specifically about your program or service. So if there are any questions.
You have a question. So in some of the definitions, it says that prior approval must be obtained. And within our organization, there was an argument of whether the application submission and approval process meant we were approved or if it was something else entirely.
So it's an excellent question, and that has come up. So an example of a service that needs prior approval is in our case management tiers, which is case support, case management, and care coordination. Case management and care coordination do require that approval because we need to make sure that the policy, procedure, et cetera, is well documented and used within the organization in order to bill those services. So you can certainly, if let's say you want to propose care coordination, your applications are coming in the month of October. So that gives us opportunity to come out and take a look and work with you to see if you qualify for that. So if you include it in your application, but you haven't yet received that formal approval to bill that service, worst case scenario, it's not going to be approved at that highest tier rate or the tier that you're requesting, but it could be actually approved at a lesser tier, and we will work towards making sure that everything is in place for that eligibility to bill that service. And then your budget will be updated accordingly once that final approval is in. Does that answer the question well enough?
Yes, thank you.
Okay. Other
And
questions?
if you do need, we do have a matrix with the service tiers all on it. If you do need that, just email us and let us know so that we can send that out to you so you can see what is required for those three, for case management and care coordination. I don't know if that is on our website yet, but we most definitely can send you that matrix so you can see what's required for those service tiers.
Thank you.
Are we on?
Yes.
Hey, Susan, quick question regarding new clients.
Yes.
Does that mean, how are we defining new clients? Like, we haven't seen them in a year, we haven't seen them in 6 months, we haven't seen them in 3 hours. What are we going with on that?
Yes, 1 hour and 43 minutes. Thank you, Kelly.
You're welcome.
So we're looking for, just in terms of, to make it easy and consistent across the board, your contract year. So for 2020, for your last year that you have a solid number of folks that came new into services, then you're going to go by that. So weren't served in the previous grant year.
Okay, thank you.
Okay. Any other questions? All right, very good. Next slide. So in the past, we have done this before. If you have if you have any additional questions that you didn't think of this morning, or if other folks in the organization come back and review this presentation, you can submit additional questions up until September the 22nd, close of business, 5 p.m. And we will turn around and post those answers on our website so that everyone has the advantage of seeing those, and send those to administration@jacksoncountycares.org, and that goes to Taryn, and so we will respond to those. If you have specific questions. Oh, go ahead.
I do have a question about the last issue. So generally, we consider a client new if they have to have an intake. But if someone hasn't been seen in 9 months, we generally do an intake because their situation will have changed. So we don't really use the were they seen in the previous year. What do you think about that?
So I have a thought.
Yeah, Bruce, you want to weigh in?
Well, everybody's going to be a little different. And so a complete contract year for us is, you know, hopefully a pretty straightforward default. But the last thing that we want to do is to cause you to redefine long-held practices. So just use the definition that you have. And if we have questions, we definitely won't hesitate to ask, right? And you'll have the answer.
Okay, so I love that answer. Thank you so much.
Thank you, Bruce. So if you have any issues navigating the portal, you can feel free to contact me and we can walk through there. Next slide. So here's our timeline. We will post this presentation on our website. Written questions due to administration@jacksoncountycares.org on the 22nd. Applications are due by noon, before noon on October the 7th. And I can't see the rest of this. Hold on. Appropriations meeting will be held by Zoom, and that is currently scheduled for 9 a.m. on November the 9th. We will send out confirmation and reminders of that. So just watch your email for those coming. Next slide. Bruce, you want to talk about contracts?
Yes, thank you. So with proposal approval, we use an electronic signature process. We found that to be very speedy and helpful, and we can easily determine whose desk it's on in order to just expedite all of our processes. We've got some closeout deadlines for the prior year that are also part of the process. So all quarterly billing is due 30 days after the end of each quarter. So that hasn't changed. And so the end of year fourth quarter billing will be the end of January. Again, no change. And then also the same with the annual demographic report, same time frame for that. And the reason for mentioning those here is that we need those, we need the prior year closeout before we start the new year payment. So nothing new, just a reminder.
Thanks, Bruce.
And with that, again, I just would encourage you, if you have other questions, let us know, send them to administration@jacksoncountycares.org. We'll be happy to look at those, and there's always good questions. So I appreciate your thoughtfulness in sending those.
And last but not least, thank you very much for attending this morning. Again, it'll be available on our website. And if there are no other questions right now, we will let you go to finish out your day.
Thank you. Have a nice day.
Thanks, everyone.
All right. Thank you.
Thank you.